Hi, I am Dr. Christine Anderson, or Dr. Chris as my patients affectionately call me. And I am coming on this evening to talk about the reflexive system and why it is so important and why we need it for our survival, brain development, and our optimal function. And this is something we don't often think about because when it's working and everything is going well, it's just reflexive, right? Our brain doesn't really have to think about doing these things. And so everything is fine. But when they aren't working, that's where the problems occur. So let's get started. So, what are the reflexes? Why do we need them? Well, they are involuntary movements in response to a stimulus. And they're pretty much instantaneous. And the reason why this occurs is because it bypasses the brain. So normally sensation comes in, and let's just say you're seeing something, and the information goes into the part of the brain that will look at what you are seeing, the vision aspect we really see with our brain. And then it goes to a part which is going to analyze what you're seeing, and then you're going to act on it. So that's a typical what we call sensory motor. Sensory, you're taking in the information. Motor is your body is moving and responding. But in this instance, let's just say your survival depends on you acting quickly, and it takes more time for that information to get to the brain. So this is a way bypassing the brain, going through either the spinal nerves or the brainstem, which is going to be a much quicker action. And then you are going to be able to act after that. But that initial reaction isn't involving the brain whatsoever. And this is why we say, oh, it's your reflexes or it's a reflexive action. You're not thinking about it. And some of these reflexes are necessary actually when we're babies for our brain to develop. So let's look a little bit at the nervous system just to get a big picture. And here we've got the two components, the central nervous system, which comprises basically of the brain and the spinal cord. And then you have the peripheral nervous system, which comprises the spinal nerves, and there's two aspects of that, the autonomic or automatic system, and then the somatic system, which is our body functioning system. So let's go a little bit deeper into each of these. So when we look at the brain, the central nervous system, we've got the brain, also we call it the cerebrum. The brainstem, which is the bridge to the spinal cord, and that is where we've got the spinal cord, which has all the nerves and all the tracts from the sensation from the rest of our body going up to the brain, and then the brain tracts going down from the brain to the rest of the body for acting. And then we're going to talk a little bit more in the future about the brainstem, but this is more of the bottom rungs of the ladder in brain development, and this is where a lot of reflexic action occurs. And we'll talk more about which ones those are. And then we have the peripheral nervous system. So this is out in the rest of the body. As I said, we've got that autonomic system, which is broken down into the parasympathetic or rest and digest, and the sympathetic or fight or flight action. And each of those comes off of different parts of the spine. Parasympathetic is more of the cranial system, the neck, and the sacral area down in the lower spine, and the sympathetic comes more off of the thoracic area in the mid-back and the lumbar spine in the low back. And then the somatic areas, which go to all of our muscles that we use, so these are voluntary muscles, is what you think of like when you're doing a bicep curl. So you're like, I'm going to bend my arm. That is using a somatic muscle. So it's a voluntary contraction versus the autonomic. It's working on our systems that are really involved in our moment-to-moment actions of needing to live, like your heart beating and your breathing, your stomach digestion. You don't have to think about those things. They just happen, and that is because of the autonomic system. So this is showing a little bit of the reflexive system for the somatic system. And this is what we think about. You've got a picture there of a hand, which is going to put that person's going to put their weight on this tack or whatever sharp object. And that is going to send messages through the spinal cord. So that is a cross section of the spinal cord there. And the characteristic shapes that you see and the things you see in the spinal cord are really what the tracks that you're finding going from the brain to the brain and from the brain, and the different areas where they exit. And so you have different aspects of this. And I don't know, it's super interesting to me, but there you have a basic reflex arc. You only have what we say one synapse, where you've got that fiber coming in. It's a pain fiber coming from the sensory stimulus of this tack in the hand, and it goes into the spine, into the spinal cord, and it then sends a message right out to the motor component of the, let's just say the bicep, to bend the arm to get it off of the tack. Okay, so it's a very simple response. Now, if you look at that cross section of the spinal cord, you can see there's also a fiber that crosses to the other side and will go up to the brain. So at the same time this reflexive action is happening, you're also sending a signal up to the brain to let it know what has happened, just in case further action needs to happen. So, you know, maybe there's more tacks around and you go, okay, I see there's more tacks, I've got to be careful. The other really cool thing about this, so this is a perfect example of a withdrawal reflex. And we all have it. You know, you touch something hot, you're going to bend your arm and you're going to go away from that flame without even thinking about it. You know, if you touch a hot stove or something like that. If, let's say, this was your foot that you were stepping on a tack, what also kicks in is something called the cross-extensor reflex, where you step on the other foot. Now, the deep tendon reflex is a little bit different. Same sort of mode of action at the same level. And by the way, this is all on the same side of the body, which is another interesting thing, because normally when we are having top-down control of the brain, let's say I was voluntarily moving my bicep muscle, and let's just say it was the right side, my right bicep I wanted to flex. Well, normally my left brain would tell my right bicep what to do. But in this instance, it's all on the right side, so it's the same side. So this is, I mean, it's interesting to me, but this is part of the neurology. Same thing occurs, you know, when the doctor takes the reflex hammer, whether it's a chiropractor or a medical doctor, and taps your patellar tendon, or your biceps tendon, or tricep or Achilles. These are all the deep tendon reflexes. So this is showing the patellar. You can see it has that same mechanism of action, but there's actually another thing that goes on, and you see another nerve tract that goes to the other side of the leg in the hamstrings, and what that does is it dampens the response of those muscles, because the hamstrings want to bend the heel to the butt, right? So when you're bending your knee, you're engaging your hamstrings. So I don't know, this is super cool to me. And you're also going to see the deep tendon reflex. You see their spinal cord level L2 to L4. So let's just say I have a patient with a lumbar spine injury. Maybe they were in some sort of sports injury or an accident. And when I check the patellar reflex, what I'm looking for is the right amount of action. So if they don't kick at all, that means that it's not activating at all. Is it an issue with the sensory fibers? Is it an issue with the motor fibers? I don't know, but that's just something that I note along with the rest of my exam. Or is there an issue with the leg keeps kicking and doesn't stop? So normally there's a brisk motion, the leg kicks, and then it stops. Because what happens by that time, remember that other side, there's a fiber going up to the brain, and the brain has top-down control and sends a signal down and says, okay, stop kicking. And if it keeps kicking, there may be an issue with a central nervous system problem, with actually a brain problem that is not having that top-down control to tell that leg to stop kicking. So this is why these are all important. We don't think about it, but this is actually looking at the integrity of the nerve pathways as well as where they enter into the spinal cord. There's certain levels that they do, and we know which ones those are. And then also the brain aspect. Is the brain having that top-down control to inhibit the reflex from occurring once it's already occurred? Then we have the autonomic system. So this is the part that we don't think about. Our heart rate, blood pressure, breathing rate, digestion, all of the rest and digest issues. And here's a diagram showing this aspect with what goes on with heart rate. So you have something called a baroreceptor in your blood vessels that monitor what's going on with your blood pressure. And then that sends information into your brainstem. And then your brainstem, through something called the vagus nerve, it's one of the cranial nerves, sends whatever the brainstem is interpreting. Let's just say your blood pressure is maybe dropping. It's going to send that information to the pacemaker part of the heart that says we might need to pick up the heart rate a little bit. We need to pump a little bit more blood. So it's assessing what's going on internally all the time, 24/7. It doesn't get a break. And this is what we're talking about with the autonomic or a visceral reflex. Now there's some other things that are part of this too. Blinking, sneezing, coughing, swallowing, gagging, your pupillary reflex, where if you shine a light in, your eye is going to contract based on excess amount of light. And then I've got yawning with a question mark. And yawning is a pretty interesting one. They aren't really sure why we yawn. You will hear things like you need more oxygen to your brain. Maybe you need to cool your body. It's because this involves an inhalation of air. It stretches the eardrums, and then you have a long, large exhalation of breath. So, you might be tired, you might be stressed, maybe you're bored. It's really one of those sort of human functions that is kind of interesting and, I don't know, maybe even a little bizarre. We also know there's a social component to this. Have you ever noticed how it's contagious, right? Someone in the room will start yawning and you're like, oh my gosh, don't start. You're going to make me yawn. Well, this is actually a phenomenon. And studies have actually shown that children on the autism spectrum are less likely to catch a yawn, if you know what I mean. They become immune to other people yawning and don't tend to yawn. And so this is very interesting just because this may be due to things like mirror neurons, which I've talked about in the past with autism, and the fact that mirror neurons might be an aspect, or it is an aspect, but one of the theories based behind what is going on in the brain with a child with autism. So this is the autonomic visceral reflex. And again, if we do not have this reflex occurring, there's no survival. You can't live because there's no way that you can control these consciously 24/7. Yes, you can slow your heart rate down and your blood pressure with deep breathing and help your digestion with relaxing. But on a 24/7 basis, that's all you would be doing if that is what was needed for these things to work. All right, so let's get into the primitive reflexes, which are the infantile reflexes. These are the ones that develop in utero and they help babies to be born and to survive in that first year of life. And not only survival, but also they are the first ways to stimulate the brain. So think about this. And I'm going to talk next time more about primitive reflexes. But when you think about it, how are you supposed to move a body that doesn't have a brain to move it? So that's the somatic aspect reflex, right? To move our bodies, we actually have to have a brain that tells us to move. Well, this way with these primitive reflexes, they are involuntary. If you stroke a baby's cheek, they're going to turn their head to the side. It's reflexive. They don't have control over it. And these primitive reflexes occur again in the brainstem. This is a crucial area in early childhood development. And these reflexes, for the most part, babies are born with them. There are a few that come online a little bit later, but typically most of them are integrating in the first year of life. And then they can go on to develop more mature reflexes, which are the postural reflexes. And this is something that I check out when babies come in to make sure that, number one, as a newborn, that these primitive reflexes are there, because if they're not, that may mean there's an issue with the communication in the neurologic system. Or if they are at a certain age, these reflexes should have integrated. And if they have not, then we need to make sure that the right sensory information is getting to these kids so that they can have that maturation of the nervous system with not only the postural reflexes, but because the brainstem and the development is sort of the bottom rungs of the brain development ladder. If children are having workarounds with retained primitive reflexes, and they can do workarounds, but it often will come out later on as postural issues, behavioral issues, academic issues. Something is going to give. You can't do a workaround and just have everything going beautifully. At some point, something will come up. And then we are to the postural reflexes. So this is that subconscious control of posture, balance, coordination, and things, again, that we take for granted. But just think about maybe as an adult, you've had a little bit too much to drink and you lose your balance and coordination. You're like, whoa, okay. I've had patients come in who have had issues with things with their inner ear, or there's something called the vestibular ocular reflex, which I will definitely be talking about. And so you're walking around and you feel like you are on a boat all the time. It's a really crazy phenomenon. But for babies with their development, if they don't have that movement from the infantile reflexes to postural reflexes, then they're going to have trouble supporting themselves, sitting up on their own, and sitting in a cross-legged pattern versus a W pattern, I call it, where you have the knees in and the feet out to the side. Having trouble pulling to stand and walking. These might be issues, and then once they do start getting on their feet, because these are triggered by gravity, they may have trouble having proper posture, and so shoulders may be rounded. This is all the stuff I look at, not only in children, developing children, but also with adults. So postural reflexes do begin at birth. They will kick in as babies are starting to try and move against gravity. They help with milestone development because they have to have a certain amount of core strength to do things like get on hands and knees and crawl. And by the age of 3.5 years, these postural reflexes should really be solid and have replaced the primitive reflexes. And these include things like the writing reflexes, like if you move your head one way, your eyes are going to accommodate for that movement of the head. Equilibrium, this is more about balance, shifting your weight if you're on an uneven surface, knowing what you need to do to maintain your balance and your posture. And I'm going to go more into these in depth in a future episode. So let's kind of put this all together with reflexes and chiropractic. So as a chiropractor, the whole philosophy of chiropractic is that the adjustments help to remove any subluxations, which are misalignments or interferences to the nervous system, whether it be from the outside in, that's the sensory, or from the top down, which is typically the motor. So we take in information and then we act on it. And there has to be this sort of safety pin loop. And if there's any interferences in any of the neurologic patterns, you might have a problem with going on with your reflexes. And that's going to affect how you adapt to your environment. And it goes all the way back to what we call the 3 T's: trauma, thought, and toxins. So if you have a physical stress, let's say you had a car accident or a sports injury, it can disrupt your reflexes. Maybe even, for example, your sprained an ankle, it affects your proprioceptive system. That tells your brain where your foot is, and this is why people often sprain their ankle again. But that can throw off your whole balance as far as your equilibrium or your writing reflex, can affect how you're walking. That can affect, again, the neurologic input into your brain. So this is how these things can kind of snowball. And then with thought, acute or chronic emotional stress. Well, chronic stress, we know, can affect our brain, which can affect the body function. And I've gone into this in multiple episodes. I will put them in the description, talking about the effects of stress and what it does on the brain and the nervous system. And then toxic stress. So this can be endogenous, coming from your body, and that's the metabolic processes. Or it can come from the outside, from things you're eating, drinking, ingesting, injecting. And when you create stress, it can affect your body at any level. And that includes with toxins that can affect multiple systems, because the nervous system controls everything in the body. And then we look at improper sensory stimulation. And this is really interesting too. Now, a very extreme case of this would be people who cannot perceive pain. Now you might think, oh my gosh, that's really great, never to have pain. But when you think about it in this reflexive system, it can be very dangerous to your survival. Like you put your hand on a hot stove, and the only way you know that your hand is burning is when you smell your flesh burning. You don't feel that sensation. So that is an extreme example about how, if you have any disruption of that neurologic pathway, it can affect what goes on with this reflexive system, which can put your survival and certainly your optimal function at risk. Now, for certain things like primitive reflexes, if you don't have that proper stimulation, let's say babies put in contraptions, then they're not going to get the right stimulation of being able to move their bodies through the primitive reflexes, and therefore their milestones might be delayed. The brain unable to stop that reflex action. Remember when I was talking about the deep tendon reflex, you have the nerve fiber going to the other side of the spinal cord and going up to the brain. So part of that is, hey, a reflex was just elicited. And the brain goes, okay, well, enough of that, stop. But if you don't have that top-down control, that is a clear problem of brain not functioning optimally. And we'd have to figure out why, as far as being a chiropractor. And I would go back to those 3 T's and look to see about what that cause might be. So as a chiropractor, I am removing any interference to the reflex neural pathways as well as all the pathways. And that is the beauty of chiropractic, because I can find these things as a chiropractor, and you don't necessarily have to have symptoms, but it may be the first sign that your body is being stressed out. And for children, it may be a sign that there are some things we can do to help with their development. So this is my website, Los Angeles Chiropractor. You can reach out to me through my website, contact me. I would love to figure out how I could help you with functioning optimally with your reflexes system, either for yourself or for your child. And as I said, next week I will be talking more about primitive reflexes. This is one of my favorite topics, and with children coming in that first year of life, to be able to check if they have their primitive reflexes and then to make sure they're integrating, and if they are not, then there are some things that we can do. And this is one of those gaps I feel that I am really great at filling, because most medical pediatricians are not testing for primitive reflex integration. All right, have a great week. Give me a thumbs up if you appreciate what I said, if not like what I say. And please subscribe if you haven't yet, and share with your friends, because everybody needs to know about the reflexes. All right, have a great week, and I will see you for the usual time next Tuesday, 6:30 p.m. Pacific time. Bye.